walked up into a patient's room and felt nervous or intimidated by all the lines and wires and wondered, what do I do? Where do they go? Well, today we're going to show you what to do.
Something I do when I first walk into a patient's room is to make sure that all the equipment is in the right places. For example, her oxygen is not in both of her nostrils, so I'm going to go ahead and fix that. Sorry. So one of the best ways to think about it is making sure the horns are pointing back when you put it in the patient's nose. And then I'm going to come around her ears and then just tighten it up. Okay. Another popular line that most cardiac patients will have after surgery is the swan scans catheter. It usually is coming out right outside their neck, and it usually is hooked up to a bunch of other IVs or medication, and it just goes into one of their pulmonary arteries and measures pulmonary pressures, cardiac output, and a bunch of other heart functions. This is a central line. So it's also usually hooked up to a bunch of medications, and it usually is coming out of the patient's neck as well as the swan scans. Just be careful with both the swan scans and the central line not to pull it out when you're walking the patient. If it is slipping out or you notice the tape is coming off, just notify the nurse and it should be fine. Okay, another thing you may deal with is this chest tube. So don't do what I'm doing right now. Don't go above the level of the patient's chest when ambulating or any mobility with the patient. I'm just going to point out a few things on this chest tube. This right here is usually where suction will be hooked up to, and it'll be into the patient's wall. Just make sure you remove it before mobilizing them, but make sure you put it back on when you're done. Also, most therapists like to measure how much fluid they drop when mobilizing, so you can look at where they started before you got them up and then just mark where they ended when you're done mobilizing them and let the nurse know.
Okay, some patients may have a soft restraint when you come into their room. This can happen for two reasons. Either if the patient is aggressive or if they're pulling out their lines and leads. It's usually either slip knotted to the bed or has a hook. It's appropriate to take it off for therapy. You just have to make sure you reapply it when you come back to their room. Alright, so this is an IV. It goes into a patient's vein for medicines. The thing you want to be careful with that is bending the patient's elbow or putting weight on their upper extremities, such as on a walker when you're ambulating, because these can be uncomfortable for patients. And if it becomes unattached, you need to alert the nurse.
A patient might also have a Foley catheter, which looks like this. The important thing to remember about this is to keep it below the level of the bladder, and then also check it for any blood in the urine, and just to make sure urine is looking normal.